the retiree premiums. Okay. So sometimes when we send out an initial pension packet, maybe someone has not investigated how much retiree premiums are going to cost them, and they get their first packet and they see these premiums for the first time. I kind of feel like it's sticker shock. Like especially those of you who have worked steadily as a carpenter and have steadily had the active working carpenter health benefit for years and years and years, you kind of forget how much health benefits cost. Okay. So the way this chart that I have up on the screen works is you're going to look for your number of years of eligibility service. And again, you want to look at your credit printout with the A on the top right, and you want to look for your years of vesting service on that credit printout. For most of you, the years of vesting service is going to be equivalent to years of eligibility service. So for someone who has 30 or more years of vesting service, eligibility service, the monthly premium for Blue Cross Blue Shield for someone who is not yet Medicare eligible, I'm going to actually use a marker on the screen here. So right now we're talking about individuals who are not yet Medicare eligible. Okay. For someone with 30 or more years of vesting service, the Blue Cross Blue Shield Major Medical is going to cost $187 per person per month. Okay. So it's a carpenter and a spouse, $187 times 2. If you still have dependent children who are eligible for coverage and not yet on Medicare, you'd also pay $187 for each child for each month. Okay. Once you become Medicare eligible, and it doesn't matter who becomes Medicare eligible first, it can either be the carpenter or it can be the surviving spouse. If one of the individuals, one or more of the individuals is indeed Medicare eligible, then the Carpenter's Blue Cross Blue Shield will be a secondary payer to Medicare, and we will look at the coverage charts after we get through the premiums, okay? So I'll explain coverage after we get through the premiums. But if you or your spouse, or maybe even one of your children might happen to be disabled, if you are Medicare eligible, Medicare is your primary carrier, so therefore your Carpenter's Blue Cross Blue Shield will be a supplement to Medicare, and your Blue Cross Blue Shield Medicare supplement premium will only be $47 a month. Now that's for someone with 30 or more years of eligibility service, of vesting credit. Okay. For someone maybe who only has 10 years of eligibility service, you can see that the premiums are considerably more, $300 per person per month for the Blue Cross Blue Shield pre-Medicare, or $80 per person per month for the Medicare supplements. Okay. Prescription drug coverage is a separate election and a separate premium. So if you also want to include prescription drug coverage in your retiree health benefits, if you have 30 or more years of vesting service, eligibility service, prescription drug coverage costs you an additional $75 per person per month. Okay, so you're going to have to do a little bit of math here to figure out what your actual premiums will be. The coverages are independent elections, so you can choose Blue Cross Blue Shield without prescription drug coverage, or you can choose prescription drug coverage without Blue Cross Blue Shield coverage. I'm also going to switch over and make this a highlighter. So my example was a carpenter and a spouse, neither one Medicare eligible. I said your Blue Cross Blue Shield is 187 times 2. Well, maybe the carpenter is already Medicare eligible, so the carpenter's Blue Cross Blue Shield premium would be $47 a month, and then the spouse's Blue Cross Blue Shield would be the $187 a month. So it would be $187 plus $47 if one of you is Medicare eligible and one of you is not. The prescription drug coverage premium does not change once Medicare comes into play. So the prescription drug premium would still be $75 per person per month. If you had some years where you earned some construction credit and some Millman credit, it gets a little bit more complicated, and you want to give the fund office a call. So those are premiums for Blue Cross Blue Shield and prescription drug coverage. We're going to look at vision and dental in a minute. Okay. So first, know that your premiums must be deducted from your monthly pension payments. Okay. You can't just send a check to the pension fund office. We're going to deduct your premium payments from your monthly pension check. Okay. I already mentioned this, that Blue Cross Blue Shield and prescription drug coverage are separate options with separate premiums. Dental and vision coverage are additional and separate, and the next slide has dental and vision premiums on it. The premiums are subject to change. However, I want to just mention that your board of trustees knows that how much you need to pay for your retiree health benefits directly impacts your standard of living once you move into retirement and you have your pension as your source of income. So the premiums on your screen have not changed since 2011. Okay, so they've been the same for 11 years. So the Board of Trustees does not raise premiums lightly. They do everything in their power that they can to try not to raise premiums. In the premium history of the plan, these premiums started in 2011. Prior to this increase that happened in 2011, and in fact 2011 is when we moved to this tiered premium structure, the prior increase before that was back in 2006, and the prior increase before that was actually back in 2000. So it's not, at least not currently, an every year occurrence where the premiums could change. That said, the trustees do evaluate these things on an annual basis to see what they can still sustain. These premiums are actually highly subsidized by the active working carpenter hours. I'm doing this from memory today because I don't have this note with me, unfortunately. But I believe that if you are at the 30-year eligibility tier, that your premiums are subsidized by the active working hours to the tune of something like 70%. And even if you only have 10 years of eligibility service, these premiums are subsidized by about 40% by the active working hours that are coming into the plan. Overall, the premiums that are collected through the pension checks, the premiums that the Retirement Benefits Department collects, only cover about, I want to say 35% or so of the actual claim cost for the retirees. So the pension fund, the welfare fund, the health, now renamed the health fund, does not profit off of these in any way, shape, or form. So I urge you and encourage you to go out there on the marketplace and see what's available and what those premiums are, because I think if you do that, you're going to find that these premiums are extremely reasonable, very competitive premiums. In fact, they're probably going to blow the premiums you can find through other coverage away when you consider the benefit coverage, which we will talk about in just a moment. These benefits are very similar to your active working carpenter benefits. And I doubt you will find anywhere on the marketplace, premiums available that are this inexpensive. Okay, back on the slide, on the left-hand side of the slide, I just brought up another point. The retiree, the carpenter, must have coverage before the spouse or dependent can take coverage. So the carpenter has to have Blue Cross Blue Shield in order for the spouse to enroll in Blue Cross Blue Shield, the spouse or the kids to enroll in Blue Cross Blue Shield. The carpenter has to have prescription drug coverage in order for the spouse or the kids to enroll in prescription drug coverage. Even on the next slides, we'll look at vision and dental. The carpenter has to pick up dental in order for the spouse and the kids to have dental. The carpenter has to pick up vision in order for the spouse and or the kids to enroll in vision. The one sort of explanation I would like to make to that is that these two columns here where we're talking about Blue Cross Blue Shield, both pre-Medicare and post-Medicare. If the carpenter has one or the other of these, and if the spouse is the opposite, so the carpenter is not Medicare eligible, but the spouse is, that's okay. This is still Blue Cross Blue Shield. As long as the carpenter has one of these, the spouse can be enrolled in the Blue Cross Blue Shield, even if the spouse's Medicare status is the opposite of the carpenter's Medicare status. Dependent children can still be covered up to 26, just like on your active plan of benefits. And if you have a disabled dependent child, that disabled dependent child may still be eligible to keep coverage past age 26. There are forms to be completed for the doctor, the dependent child's doctor, to certify disability. And then we'll also look at whether or not that dependent child, disabled child after age 26 is still dependent on you, the carpenter, for a percentage of his or her support. I believe it's more than 50% of their financial support is also a requirement. But give the fund office a call if you have additional questions on that. Medicare, and this, I believe I've spoken to this already, Medicare eligibility is on an individual basis. The retiree and the spouse may have different Blue Cross Blue Shield coverage depending on your age and your Medicare status. And the retiree Blue Cross Blue Shield, just like your active Blue Cross Blue Shield, is a PPO plan. Okay, so it's not an HMO or anything like that. It's a PPO plan, just like you've had under the active plan. So if you're moving from your active plan to your retiree plan, you're going to be able to keep your same providers.